It was one of these things that was started back when President Adams was president, and this is a long time ago, in the 1790s, I believe. The first hospital in the state was at Port Townsend and was moved to Seattle as part of the United States Public Health Hospital system.
When the building opened, I think the services were basically hospital services for the indigent and for people who were owed care by the federal government, like the Merchant Marine, the Coast Guard, federal employees, public servants who could not afford, generally when they got older, the kind of care they needed.
I found in 2003, 2004, is that the organization was held together by an emotional commitment on the part of the employees to continue to do great work with one another.
PacMed, it's like a family to me. It's my second home. People here, they are amazing and to work with. The leadership, the staff, the ideas, the things, the new ideas that people come up with every day. It's just amazing.
I think PacMed has raised the level of care, the quality of care that we provide patients. When you go to the Washington State website now to look at the level of quality of care for patients, we're one of the leaders.
I came on the board in 1989, and Pacific Medical was a much different organization then than what it is now. At that time, the organization only had 3 clinics as opposed to what's 9 now. We also had a cross-cultural center which was pioneering in training doctors and providers to deal with people that couldn't speak the English language.
The focus is on the patient. What is the best way to serve the patients that come into the PacMed clinics?
One of the things that originally stood out to me when I first started was that they had a patient assistance program. A lot of people would come in and they would not be able to pay for services, but they'd get referred in and they'd get everything that they needed, from just a basic visit to a diabetic foot check to cancer treatment.
Project Access is a conceptual framework that's a national model, and when we tried to bring it to Seattle, PacMed was one of the only organizations that saw the logic in the model and was willing to engage with us as we learned whether or not this would work. The benefit to the community is both in dollars and cents and in patient stories. So in 2013, Project Access Northwest, through the generosity of systems like PacMed and our other partners and the 1,260 specialists, provided over $18 million in donated care to this patient population. We get to help people go back to work. We get to help folks return to a useful life. One of the patients we sent to PacMed got a corneal transplant at PacMed. That guy got to see his 4-year-old kid for the first time. He was 34 years old.
I love PacMed. The day after Thanksgiving in 2012, I got a phone call from Dr. Ludwig, and he told me that I had cancer. I had a lesion on my breast, and Dr. Ludwig looked at it, and then he right then said, I want someone else to look at this. From the moment I became in Dr. Ludwig's care until today, they've done everything for me. I have not had to make an appointment or do anything at all. All I do is listen to what they have to say and show up. And they take care of me, and I'm doing great.
I think PacMed in the future needs not to forget its past and its legacy, basically, which has been a provider that would take care of people from multi-ethnic groups from all over the world who have just come to this country, who have really different needs than the average person.
Right now, what we're doing is we're consolidating the efforts of the last decade. And we're putting it into a position where people who are in this organization today are going to take it to the next level.
Now Harvey's taken it to a new, higher level, And I think this new idea of joining with Providence is going to be a great for the future of this organization. And I'm proud to have supported it.
This place is needed. The clinic is certainly needed. You have to figure out, how do we fit in a changed environment? What do we have to do going forward to keep this place viable and a provider of health services?
Pacific Medical Center has been given an opportunity to write the next chapter for our company. And who's going to write that chapter? You are.